What are causes of ED? There are multiple causes of erectile dysfunction. The most common causes are vascular disease, medical conditions such as diabetes, as well as a variety of medications that we are taking in order to preserve our good health. Apart from that, there are some other causes, including pelvic surgeries that can result in erectile dysfunction. But in general, erectile dysfunction is something that happens to most men as we get older. Erectile dysfunction can also result from treatments of prostate cancer. And it's also important to know that erectile dysfunction can be a precursor for heart disease, and oftentimes can be the first presenting sign or symptom of diabetes. Question is, I have low testosterone. Can this cause erectile dysfunction? Well, first, let's talk about erectile function. There are several factors that play a role in erectile physiology. Those include blood supply or vascular function, nerve supply or nervous function from your brain and spinal cord, as well as hormones such as testosterone. So the answer is yes, testosterone can play a small role in erectile function. Perhaps more importantly, testosterone plays a bigger role in the man's desire for sex or libido, as well as several important functions in the body. What are different treatment options for erectile dysfunction? Well, there are 5 FDA-approved treatment options for erectile dysfunction. And I'm going to give you sort of a broad, big picture view on all of them. The first and foremost is oral medications, or PDE5 inhibitors. And then in no particular order are treatments including vacuum erection devices, intraurethral suppositories, intracavernosal injections, the likes of Trimix or Bimix, as well as a penile implant or penile prosthesis. So why should you see a urologist to treat your erectile dysfunction? Well, first and foremost, it is important to consult with your primary care physician about your ongoing issue. They may refer you to a specialist such as a urologist, or even more specifically, a sexual medicine specialist such as myself. It is important to see specialists because while your primary care doctors can offer initial treatments such as oral medications, they may not be able to offer more advanced treatments such as the other 4 FDA-approved treatments for erectile dysfunction. So it is important to ask for that consultation when it's time to discuss this a little bit further. Urologists are the only doctors that can offer treatments beyond the pills and beyond medical treatments, such as surgical treatments of the penile implant. Here, I want to make an important distinction from primary care doctors and urologists to what are called men's clinics, centers that are out there offering men treatment for erectile dysfunction with things like testosterone as well as Trimix injections. While these places are able to offer this, they are no specialists in offering you treatments for erectile dysfunction. These are very high-profit organizations that simply can offer medical treatments for parts of your erectile dysfunction, but likely don't offer a full workup and full service of treatment options that are available. Will people know if I have an implant? No. The short answer is no. I tell guys, even if you're going through the airport and through the security, nobody would know that you have an implant. If you're in a locker room taking a shower, nobody should be able to tell that you have an implant. A penile implant is a very discreet type of surgery with a very, very small scar that's usually hidden, which will prevent from anyone knowing that you've got an implant surgery. In the flaccid state, the penis looks as natural as possible, and in the erect state, the penis also looks as natural as possible. What is the satisfaction rate with penile implants? The satisfaction rate of penile implants is 98% amongst patients and 96% amongst partners.